I want to bring in Dr Kyle Hoath now. He's the president of the AMA here in WA. Good afternoon to you.
Good afternoon, Ollie.
Last year you expressed some concerns about another private company taking on Mount Hospital. So how do you greet this news today?
Oh, look, our major concern would be the loss of it as a hospital rather than another hospital operator stepping in. We see this as a good outcome. Like to have lost a hospital would have been a disaster, especially as we head into another tough winter. So no, this is a good outcome today.
Listening to Dr Neil Fong there, are you confident Bethesda can deliver the quality of care that Western Australia requires?
Yeah, look, I think the team at the Mount are already pretty good at what they do. I know the hospital group may have been struggling, but the Mount was doing relatively well, and there's some very experienced doctors and senior leaders there that have been there for a long time. So, Bethesda have run a similar operation out of their hospital in Claremont. I think the combination really is a good match, particularly if there's some capacity to see some of that excess beds be used by the public sector, which I guess gives some revenue to Bethesda, but also some capacity to the public health sector. So I see it as a bit of a win-win this time around.
Is it putting a Band-Aid on the system, though, Dr Hoath? Because even the facilities there at Mount Hospital, well documented over a long period of time, issues with the likes of claims being mould in some of those older theatres. I think there may have even been some concrete cancer concerns. Are we just wallpapering over a bigger issue here and providing Band-Aids to a breaking health system?
Oh, look, we could not afford to lose the services this hospital offers. I mean, it is one of the biggest, cardiovascular heart intervention hospitals that we have in the private sector, and does a large amount of both the work we see across public and private in that space. If we were to lose that, our cardiology services in the state would be decimated. Like we couldn't afford to lose that hospital. So less of a Band-Aid fix, more of a rescue, because if there was any situation where it wasn't going to continue to function as a hospital, we'd be in dire straits. So it doesn't solve any problems, but it definitely averts a potential big one if this wasn't to happen. So it is a good outcome, Ollie.
It's a good outcome now, but are there other opportunities that may be missed, Dr Hoath, for the future planning of the WA health system?
Look, I mean, absolutely. This is a small piece of the puzzle in that grand scheme. This isn't an acquisition by the state government, so it doesn't really sufficiently or in any meaningful way increase what the public sector can offer. And it does. It's a little bit of a distraction from that larger problem, which is where are we headed? What does the future of our health system look like in 10, 20 more years? But look, no, this is a good outcome today because we couldn't afford to lose it.
Thank you very much, Dr Hoath. Appreciate your time there.
No worries, Ollie. Take care. Bye.
That is Kyle Hoath, the AMA WA president.